either uneducated or unscrupulous healthcare providers who will offer products that are not what they say it is. So yeah, so if anyone offers you somebody else's cells, just kindly say, no, thank you. Yeah.
Hi, Chris.
Hey, Kate.
Thank you so much for having us to your office and spending time with us and helping us educate people about really, really great orthopedic medical care. We've known each other for a long time.
Yes.
And I've had the privilege of collaborating with you with many, many patients. And anytime I get to introduce you at a conference, I always enjoy saying this because it's so true. And I'm not sure I know another doctor that does this, but you always do the right thing. And I'm so lucky to have you on my team for our patients. And
It's mutual.
thank you. So could you tell us a little bit about your background? Because it's kind of, we have a lot in common in that area, and what you did, and then we'll talk about what you do now.
Yes. Well, I first became interested in sports medicine when I was in college. I'd always known I wanted to be a doctor, but I didn't know what kind of doctor, since age 13, actually. But when I went to college, UCLA, I was an athletic trainer, and that got me really excited about sports medicine. I'm not an athlete, but I enjoyed being around the athletes, and I was always amazed by just the infinite number of things a human body could do with all the different sports. And I was curious about how the body worked, and so orthopedics and biomechanics and the anatomy of the musculoskeletal system was exciting to me. So that was just a natural for me to get interested in sports medicine. So I finished 2 degrees actually at UCLA, and then went to medical school in St. Louis University. And after medical school, went to residency in what's called physical medicine, or physical medicine rehabilitation is the specialty that focuses on function, so human function, whether it's the nervous system or the musculoskeletal system. And that was what appealed to me the most. And after finishing my residency training, I did a fellowship program because I wanted to learn more about the spine. I learned how to do non-surgical care of the spine. I was very fortunate. I've always been fortunate to have great mentors. I highly recommend people find great mentors as soon as possible to surround themselves with them. They'll help you flatten out your learning curves. And so I was fortunate enough to find an excellent physician, Dr. Dreyfus. And so after completing all my training, my dear wife, who also is a San Diego native, turned to me and said, let's go back home. So we came back home. And I was fortunate enough to get a job at UCSD. I was on faculty at the Department of Orthopedics, which is when I met you, actually. That was more than 25 years ago. And I always enjoyed working with the orthopedic surgeons. I learned a lot from them. And I hope they learned something from me as a non-surgeon and non-surgical orthopedics. And then not long after that, I decided I was more suited for private practice, so I started private practice. And I've now been in private practice for 24 years. Hard to imagine.
So you're in private practice when you were with the group?
I was in private practice, with our orthopedic specialists.
So what you did there is kind of how I got to know you, because I think a lot like you do. Most orthopedic problems can be treated non-surgically. That you were the non-surgical orthopedic doctor for the group. So you took care of any orthopedic problem that didn't require surgery. Right. And so you have a different, I'd say, because knowing how you examine people and diagnose people, you take a different look at it. You look at the whole musculoskeletal system. You look at how this joint might affect this joint. You look at ways to change the musculoskeletal system without surgery.
Yeah, and the orthopedic surgeons get this training as well, but it's really drilled into us in physical medicine, how the body works as a unit, biomechanically and kinetically, and like you say, how forces are transmitted from a shoulder to a spine to a hip. And a lot of these folks present with symptoms that can't be explained by imaging, MRI, X-ray, even ultrasound sometimes. And so you really need those physical exam skills to see how the person's using their body and what they're doing to maybe put too much stress in one area and how it might be influencing symptoms in another area. So that's why I was brought on board to join the orthopedic surgeons. Obviously, there is a role for orthopedic surgery. There are plenty of conditions that can only be fixed with surgery. But for patients who have chronic conditions, the only true indication for surgery is failure of good non-surgical care. And so my job was to provide the best possible non-surgical care, of course, with your help as well.
Well, that's a good point, because I think we always start out with conservative treatment,
Right.
whether it's physical therapy or something else, and maybe oral medication or something. But there's a whole lot of things you can do prior to having surgery. And I always say you should exhaust every good treatment option, which we'll talk to you about that. But before we do that, having had the experience with me personally, getting to work on you, you had an orthopedic challenge and we worked on that.
I'm a terrible golfer. That's how I met you.
Yeah, but you're a good putter.
Thank you.
So if you want, can talk a little bit about that. And then also you recently had a pretty severe orthopedic injury that I think we helped advise you on some things to do to get you at least through the critical part. So I think that treating you early and with the right treatment makes a difference. And I think for you, we did that personally, but also I think that's our goal most of the time if we can, with patients, early treatment, the right treatment.
Yeah, unfortunately, I'm so old now, I don't remember exactly when we first met, but I do remember in those early years, you did treat me for a thoracic disc injury, essentially, herniated disc, and that was affecting my already terrible golf swing. So I have a very fond memory of getting treated by you and then immediately going out to the driving range and just totally ruining your work.
I don't think that was my recommendation.
It was not. But I was the typical young male golfer who didn't always think properly. So, but you did get me through a really rough time back then. I've been fortunate to inherit some genes that give me discs that prone to herniate. So I've now had 6 herniated discs in my life. So it's turned me into a really empathetic physician. The most severe injury I had was the one that you were referring to. It's been 3 years now, where I, in the course of 3 weeks, herniated 3 discs, 2 of them in my neck and 1 in my mid-back. And that pretty much put me out for 3 months. And it was at that point that I learned the meaning of the word humility and vulnerability, and depending on the people that you love and that love you to support you, and without tearing up, you were there to help me through those really rough months. And you would call me and make sure I was doing the right things to take care of myself. And over the course of a year, I was able to pull myself out of that hole and sit here fine without any pain, without numbness or tingling or weakness or, things shooting in all 4 extremities.
Don't you think that makes us even more empathetic toward patients in pain and sympathize with what is happening to them, and not just physically, emotionally, mentally, right? That was, I know our conversation, some of them, it was really hard for you.
Yeah, I always consider myself an empathetic physician. I do care about patients. I do want to understand what their goals are. I do want to relate to them as a human being as we go through a process. Let's face it, as well as anybody, the rehabilitation process is indeed a process. It takes time. Healing doesn't happen overnight. There's a way to speed up the process, but it's still going to take time. And so it's very similar to coaching, right? So if you're coaching an athlete to become a better athlete, you work together as a team. So I've always had that relationship with patients. I think what the injury did for me personally is it helped me realize what the person might be thinking when they're suffering like this. I many times I would say to myself, God, if I wasn't a physician right now, I would be really afraid of these symptoms. Some really weird things are happening when you've got 2 discs pushing on your spinal cord. You get some really unusual symptoms. But because I was a physician, I was able to cope with it better. So I think I really understood better that part of it. I think I also found that just being a new level of patience that I didn't have previously as I worked through the process, but But I think the real thing that helped me as a physician is because I've now, like you, have had many orthopedic injuries. As soon as the patient starts describing their symptoms, I'm not just thinking about it intellectually, I'm thinking about it experientially. I'm like, that sounds like something that I've experienced, whether it's a meniscus tear, a labral tear, a rotator cuff tear, herniated discs, and it makes you a better diagnostician because you pick up on it quicker.
Wow, that is, that's amazing that you utilize all that insight to now treat your patients. One of the many things I admire about you is that you've taken, we may not talk about how many years of schooling and training and got you to a certain point, and you could have just continued your practice like that. But I think, like we think, there's a better and a best way to treat patients. And if there is, we want to do that for them. And so I think that's when our conversation started many, many years ago now about regenerative medicine, that in today's world, there might be a really great way at a low risk, positive and very successful outcomes to treat a lot of orthopedic injuries. And I'm thrilled that you're my friend and I have you here and you're right here in our neighborhood to refer to it, because I know that you're one of the best in your field here. And I've admired I don't want to get you on the topic of cell biology because I won't stop. Even take a breath. But I'd like you to talk about what this new field is and what the benefits are. And it's just really important for people to know it's there as an alternative treatment. And it's really important for medical professionals to know that it's available and that it's something they should talk to their patients about.
Yes, what you're referring to is cell-based therapies, or something that we call orthobiologics. Orthobiologics essentially refers to the use of a patient's own cells or molecules produced by those cells to stimulate the natural healing process. And this is not really entirely new concept, because you have been in the regenerative medicine space for decades, because exercise is the original form of regenerative medicine. You can stimulate new blood vessels to form in your muscles by exercising them. You can stimulate the muscles and bones to become stronger by exercising them. So we know the body has this innate ability to heal and to regenerate. The thing that gets me excited is that scientists are so smart, they've figured out how some of these mechanisms work. And what's happening now is we're living through a period of time where we're translating that basic cellular biology knowledge into treatments that basically transform how healthcare is being delivered. I'm old school. I was trained in the 80s and 90s. So I, as a rehab physician, I had physical therapy, I had cortisone, steroid injections, and we had orthopedic surgery to offer patients with orthopedic conditions. It is now exploding. This field is exploding with new options. For example, we'll talk about platelet-rich plasma, something that's been around for more than 20 years now. When I first started, we didn't have data showing the best way to deliver this care. We didn't have data to show which conditions most benefited from this treatment. Now we have that data. We can talk about stem cell therapy, which you have throughout your entire body. These cells that stimulate tissue healing and modulate inflammation in the body. We can talk about esoteric things like alpha-2 macroglobulin, which is a molecule that's in your blood that mitigates inflammation. Thank you. But these are really interesting areas of science that are exploding, and frankly, it's almost impossible to keep up because there's a new paper coming out every day.
What would be something that you have successfully treated? I know you have hundreds of successes. Give people an idea of what you can treat tissue-wise or body part-wise with PRP.
Okay. Well, so what is PRP? PRP stands for platelet-rich plasma. Platelets are cells in your blood. Plasma is the liquid in your blood. The liquid contains, I tell people, everything you had for breakfast. So it has proteins, it has carbohydrates, it has hormones, it has what are called growth factors, which are molecules that cells use to talk to each other. Some people have heard of exosomes. These are little packages of DNA and RNA that help cells talk to each other. So that's in the plasma. The platelets secrete molecules that also allow cells to talk to each other in a way that stimulates healing. So if you have a condition, the common conditions that we treat are tendon injuries that won't heal, ligament injuries that won't heal, cartilage injuries, so osteoarthritis in a knee or a hip or shoulder, for example. Chronic inflammatory conditions, a patient who has a torn disc or herniated disc that's continually irritating their nerve. So those are the most common kinds of things that we've treated.
And so to teach people and educate them about the difference between PRP and stem cells, what would you use stem cells for?
So stem cells, so first of all, what is a stem cell? A stem cell has a unique property in that it has the ability to duplicate itself, but then one of the cells that it makes in that duplication process can turn into yet a different kind of cell. So the original thought from our friend Dr. Arnold Kaplan was that back in the 90s when he first described these cells was that the stem cell would turn into a cartilage cell or would turn into a bone cell. Since that time, we've learned it's much more complicated. The cell, which lives everywhere in your body, on the small blood vessels in your tissues, is sitting there sleeping until you injure yourself. So you stub your toe, those little cells pop off the blood vessels, they will bind to the injured tissue and start secreting molecules that educate the injured tissue how to heal itself. They will also talk to the immune system and they say, thank you very much, immune system. You've done your job, you cleared away the debris, but now you need to calm down so we don't have chronic inflammation. So you take away the chronic inflammation, which allows the tissue to heal. So stem cells can be found, like I said, anywhere in the body. Every tissue practically has been described to have these cells living in them. The ones that are most studied are the ones derived from bone marrow, from fat tissue, or from tissue obtained from a donor, say an umbilical cord tissue or placenta. When these cells are obtained from the tissue, they can be grown in culture to increase their number. And if you get enough of them and you put them in the right spot, they've been shown to be effective for treating a host of orthopedic conditions. The main difference between a stem cell and a platelet cell is the platelet is swimming around in your blood. The stem cells are living on the blood vessels. The platelets only live for 14 days and then they die and then your body makes new ones. The stem cells have been there since you were an embryo. And so these cells, when you use them as a treatment, when you use platelet cells, say we treat someone with mild arthritis in the knee, those platelet cells will only stay in the joint for a week or two, but their effects can be years. Stem cells, if we inject that into a patient with severe knee arthritis, those cells will live in the joint for maybe 3 months. They're gone, but the effects can live many, many years. So the main difference is stem cells seem to be more potent. They seem to be more effective for more severe types of injuries.
The other thing that I've watched you harvest, these stem cells, I've watched you draw the blood for the platelets. And one thing I know for sure is that this has to be done in the right hands because every week somebody asks me about, my shoulder, my knee, my whatever. Mm-hmm. And for example, tennis elbow or, lateral condylitis, I'll say, physical therapy is really great for that. And also PRP injection would be very helpful for that. Oh, I had that, it didn't work. I say, where did you do it? And who did? Well, not someone great who has made it their life work like you. So I want people to know this has to be done by the right person. And also the thing that I'm just so impressed when you do this because you're so good at it and it's a must, in my opinion, when you do these injections that you're a diagnostic ultrasound specialist.
Sure.
So how do you utilize that to make sure that you get everything in the right place and why that's really important when you do this treatment?
Yeah, there's a recipe for success in anything. If you want to bake a chocolate cake, you start with great ingredients and then you do the steps properly. The same is true when you're doing a PRP treatment. So I can tell you as a physician, the single most important part of the recipe is that you pick the right problem. It's the same with surgery. You could do the world's best surgery, but if you do it on the wrong problem, you're not going to get the outcome you want. So the same is true with all these non-surgical treatments. So patient selection is key. And what our field is getting better at is defining very specifically which conditions respond best. So for example, mild to moderate knee osteoarthritis does very well with platelet-rich plasma, provided it's done properly. And to your point, properly means everything from how the blood is removed from the patient. Actually, you can take a step backwards. How you prep that patient ahead of time, get their nutrition right, get their supplements right, get their medications, get them off the medicines that might interfere with how platelets function, right? Because people take, for example, blood thinners, which impairs platelet function. You want those platelets to be able to be functioning properly. So you have to prep the patient properly. Then even the way you draw the blood too quickly, you can pop those little cells open. They don't work the same. The way we centrifuge the blood to separate the red cells from the platelets. There's 10,000 different ways to do that. Then how many platelets did you end up with? If you don't put at least 5 billion platelets in a patient with knee arthritis, you won't get a good outcome. Plenty of data on this. How do you know you have 5 billion platelets? We have to have a cell counter in your lab. So you count the cells before you inject them. How do you inject them? Well, like you said, use ultrasound guidance. The data is very clear. If you don't use ultrasound guidance, you're going to miss 1 out of 4 times. You're not going to put the cells where they count. The platelets are very smart, but you got to put them where they're needed. They're not going to, if you put them in the wrong knee, they're not going to make their way over to the correct knee. If you inject them in the surface of the tissue, they're not going to make their way into the knee. Stem cells, they may be a little smarter. They may be able to migrate into the tissue, but it still helps to put them in the right spot. After the injection, you have to ask the question, why did this person end up in this boat? Are there mechanics? This is your expertise. So which muscles are too tight? Which are too weak? What's their biomechanic of the joint look like? What's their overall fitness level? What are they doing at home or in sport that's not helping their cause? So by identifying all that, you can prolong the benefit of the treatment. That's the recipe that gets the best outcome.
Yeah, that'll be a great cake. I remember asking you several years ago, Chris, you're doing all this great thing with these injections, but where's the post-injection protocol? And you go to all these conferences and speak and teach people and everything, but and you said there aren't any. So we had the pleasure of writing those. And like you said, PRP and stem cells in these injections do a thing to the tissue and helps repair it and so forth and regenerate and proliferate and et cetera. But you have to identify all the musculoskeletal stresses that got them there in the first place. So the injection's one thing. The post-injection specific PT protocol is also important afterwards. And so it's kind of this is the whole package. If you're going to do the injection, maximize the benefit of the injection by doing the post-injection protocol. I think that's really important.
Agreed. And in addition to getting I told you the most important thing was to pick the right condition. One thing I didn't realize in my first 12 years of practice that I now realize after 30 years of practice is that almost nobody comes in with just one problem. So they may have some thinning of the cartilage in their knee. They may have a tear in their meniscus, but they also have some problems with the other soft tissues in the joint. We're focusing on the knee. In the spine is infinitely more complex. You've got multiple discs, multiple joints, multiple ligaments. If you do not treat the entire functional unit, and when I say treat, both with PT and with injection therapies, your results will be suboptimal. Well, my soapbox is being accurate in how we speak about terms. So, for example, platelet-rich plasma means that you've at least increased the concentration of platelets above whole blood level. And the reason this is important because there are many, many clinics who offer PRP, I'll do the air quotes, and it's not PRP. Or it's suboptimal PRP. The same is true with stem cells. Stem cell is such a buzzword. It has a very specific meaning in the scientific community and in the scientific published literature. And as you know, I've done clinical trials where we actually manufacture stem cells in a lab. When I say manufacture, we take a patient's fat tissue, mini liposuction, and then, like I told you, there's cells everywhere in the body. So we can pull the stem cells out of the fat, grow them in the lab, increase their number, bottle them as a pharmaceutical grade drug that will someday be an FDA approved therapy. That's what I'm working on. That's the research I'm doing. But in the meantime, we don't have true stem cell therapy based on that definition, where it's strictly a bottle of 99.9% stem cells. There are stem cell-like procedures. So for example, if we suck a little bone marrow out of your pelvis with a needle, sounds painful, but it's really not. If you do it properly, there'll be about 50,000 stem cells in that bone marrow collection. And there are studies that show that that's beneficial when you inject those cells into a joint or a tendon. Then if you instead decide to take a little bit of fat tissue, you may get 500,000 stem cells. The challenge is when we do these in the office, and this is perfectly compliant with FDA, we can do this now. There are many clinics offering this. It's not really stem cell therapy. It's bone marrow therapy. It's fat tissue therapy. Yes, there are stem cells in. So I want to differentiate what's happening in the clinic where you're getting 50,000 stem cells versus what happens in the clinical research where there may be 50 million stem cells. It's just completely different drug. And so now the good news is even in low doses, these cells do produce good results. You know, we've treated a bunch of our mutual friends with
patients,
tendon tears that you and I 20 years ago had said, forget it, go to the surgeon, put that thing back together. And then, I and some other doctors got the crazy idea that maybe putting these cells in the tendon would be helpful. And it's turning out to be the case. Much to our surprise and satisfaction. So, we are seeing not only symptomatic improvement, not only seeing, the patient who can't raise their arm because they've got a full thickness cuff tear, but now they have full range of motion. And when you go back and look at that tendon a year later with MRI or with ultrasound, you can see new tissue growth in the tendon. Now, I think the impact will be greater when we have the high dose stem cell product that is FDA approved down the road, probably 3 to 5 years from now. But in the meantime, this is what we have available.
So you once said to me, so if you go get a facial and they open a bottle and say, oh, I'm going to put stem cells on your skin, if it doesn't come from you or it comes in a bottle, it's really not stem cells. Is that
still true?
Okay.
Yeah, unfortunately, there's a strong presence of either uneducated or unscrupulous healthcare providers who will offer products that are not what they say it is. So they'll offer it as a umbilical cord stem cell or a amniotic fluid stem cell or a placenta. These are typically donor tissues. They are donor tissues, but these tissues are irradiated typically so that they don't have live bacteria in them. Although unfortunately there have been at least 2 or 3 dozen cases where they did have live bacteria in them and patients got sick. But the point is, when you treat these products, all the cells are killed. So it's really not stem cell therapy. And even if it was truly live umbilical cord stem cells, the FDA says you can't do that therapy. As a physician in the US, we're not permitted to offer those products to our patients until safety studies have been completed, until efficacy studies have been completed, and we know that the treatment is safe and effective. So we're not there yet.
Okay.
So yeah, so if anyone offers you somebody else's cells, just kindly say, no, thank you.
Yeah, thanks. Thanks, but no thanks. Well, I appreciate all this information. I know a lot of people are going to benefit from learning about this and knowing that it exists. This is going to be someone's first introduction to this. Wow, I may be able to have an injection in my shoulder or my elbow or my knee and avoid having surgery and feel great and have my pain taken away and have a better joint in the process. Besides all the information you've already shared, is there one thing, if you could talk to 1 million people that are potential patients, what would be one of the most important things that you would like them to know that's true and would be an honest and successful treatment using these types of therapies?
So specifically on cell-based therapies, whether it's PRP or bone marrow tissue or fat tissue that can contain stem cells in it, I think the most important thing a patient should consider is, first of all, I told you, that physician needs to know that they're treating the right kind of problem. That means you're not going to see your family practice doctor if you have a complicated orthopedic issue. So find someone who's board certified in physical medicine, such as myself, or board certified in orthopedic surgery, or board certified in sports medicine if they have an orthopedic problem. You wouldn't go to your cardiologist for brain surgery. They're both very smart, but they have specialties for a reason. So that allows you to make sure at least you're going to get diagnosed correctly and completely. To me, that's top. Second is you want your physician to be committed to excellence and, excellent care for you. You know they care because they listen to you, and they take a thorough history, and they do a complete physical examination, and they order the right kinds of tests, whether it's X-ray or MRI, and they really explore the problem with you. And then third, they're committed to excellence in orthobiologic treatment because they have either done research or they've published book chapters or they lecture at medical conferences or they just are, lifelong students of this very rapidly growing space. Because frankly, I learn something new every week, and that's why I'm so excited about it.
Even you, my gosh. Wow. Well, I am sure that this information will be really helpful to many, many, many people, and I appreciate you taking the time. And I just want to say one more time that I am so lucky to have known you all these years and have been able to call you, say, Chris, what do we do now? Or I've got this patient with this. And it's just so much fun to collaborate with you because we do think alike, but also I'll just say one more time, you always, if you aren't sure, you find the answer, you delve deep into it, you study it, you do research, etc., and you don't automatically think it's this because you're always attempting to find out what the absolute right diagnosis and cause is so you can treat it effectively. And I wish there were many, many more of you.
Well, thank you. I think the reason we've been friends and professional colleagues for so long is because you are the exact same way. And just the fact that you're doing this series for your patients and for people who you feel so passionately about says you're exactly the same. So, well, thanks. It's been my honor.
Thank you.